Hospital Week is a time for us to celebrate what we really do here. We get the opportunity in our field to care for people. It's a privilege that maybe the firemen, the police, a few other selected fields have the opportunity. But I think we forget sometimes that we're in a field where we should celebrate all the miracles that we have on a daily basis. I wanted an opportunity to express my gratitude to all of the employees and say thank you for everything that we do here. We have a lot of changes coming about in healthcare, so I'll be in DC learning about these changes. I will also be in DC advocating for phenomenal hospitals, small hospitals like ours. That word change is being used a lot in our organization. You hear it on the news with healthcare, and every day you come to work, you're probably hearing that word. So what does that mean to us? And employees have been asking that question. So things are changing. What do you want me to do? And it's pretty simple. There's 3 areas that we're focusing on: decreasing cost or waste, increasing satisfaction of ourselves, our co-workers, and of course our patients, and increasing quality. So what does that mean to an employee in different areas of the hospital? That's what they should be asking themselves and their co-workers and their supervisors every day when they come to work. So if you're doing a different task, you need to think, how can I increase the quality of this task? Or how can I make this a more satisfying type of a job for myself, or increasing that satisfaction for a patient? It really is about those 3 principles. And if you look at any of the changes that are coming from healthcare, they should tie into one of those. And if it doesn't make sense, if there's something that your supervisor is asking you to do, or you hear something on the news and you don't know how it ties, then your responsibility is to ask the question and say, I don't understand. How does this apply to Madison? We want to focus on our patient care, on each other, and looking at higher quality and more efficient ways to do things. I think that everyone should keep in mind, as we change, you don't let go of your values. And so as changes come out through healthcare or the organization, I think when you think about our values of respect and caring, integrity, teamwork, any of the values that we're thinking about, we need to make sure that those changes do not compromise those, or those changes need to enhance those values, because that's what is special to our organization, is those values. And so you can change the way you do things, but you're not going to change the core of Madison, meaning our values. I think new employees really think values as words on paper. And I was saying to them, a value, an organizational value, you can go anywhere and help deliver babies if you're an LDR nurse, but you can't work everywhere, or you're not going to be as satisfied in your job unless you're in a values alignment with that organization. So, I've worked in organizations where the values aren't aligned with mine. And that's the difference between when you're satisfied with the job and when you're not. When I think about the Accountable Care Act now versus when it first came out, and we all had a little fear, and what does this mean, and all the changes, if you really still look at all of the core purpose and initiatives behind the changes, they really are good decisions. Maybe the way that they're being implemented, and we don't have a say-so in that, doesn't feel great, but it's about patients. It's about patients and quality. How can you argue that, the government is wanting us to focus in on quality? As a consumer, it feels good to have every physician, every nurse, every employee in the organization thinking that quality is important. And even though sometimes it's kind of hard when you look at some of the measures that the government has, they don't feel appropriate to measure. There's some things that we could come up in our organization that we feel are more important for our patients to measure. Bottom line, quality is a great thing in healthcare to focus on. I I don't know where healthcare will be in 5 years, but at least we're willing to look at it and change and address and do better. The slogan for National Hospital Week is hospitals, where miracles happen every day. And when you come to work at Madison, you need to remember that you work for an organization where miracles do happen every day. And if I could give one request out there, it's when you see those small and amazing miracles, you give Doug or Lucas a phone call and share those stories, because that's what helps us through some of the tough days. And the exciting days around here is talking about those patient stories or the stories with our colleagues. And remembering those and talking about those is the best thing. I'd like to take this opportunity on behalf of all the executives, the board members, and certainly the county commissioners to say thank you to our over 500, I think the current number is 536, but over 500 employees here for all the work that they do. Thank you, and you're what makes Madison awesome.